Assalamualaikum warahmatullahi wabarakatuh. Now we are going to start our presentation. The title that we have chosen, which is the Russell-Silver syndrome in children. First, let me introduce myself first. I am Farhana Binti Abdullah from course Dietetics. This is the contents that we are going to present, which is first, definition, pathological disorder, clinical signs, nutritional restriction, and the last one is the plan management for patients. So, what do you think is Russell-Silver syndrome in children? Let's go find out. So, what is the definition of the Russell-Silver syndrome? It is a rare disorder characterized by intrauterine growth restriction, or IUGR, poor growth after birth, and relatively large head size. RSS is genetically heterogeneous, meaning that different genetic abnormalities are known to cause this disorder. And there is 60% of patient causes of abnormalities involving chromosome 7 or 11, and the other 40% patient is the underlying causes is still unknown. The wide spectrum of finding varies both in frequency and severity from one infected individual to another. The majority of the individuals with RSS are normal intelligent, but motor or speech delay is common.
Thank you, Farhana. My name is Nuradila Binti Azihan. We'll continue this presentation. As Farhana mentioned earlier, Russell-Silver syndrome comes from the different genetic abnormalities are known to cause disorder, characterized by intrauterine growth restriction, slower growth after birth, relatively large head size, triangular facial appearance, a prominent forehead, body asymmetry, and also significant feeding difficulties. So, what is the pathological disorder for this syndrome? Study found that genomic imprinting takes place on the inherited gene. As we know, everyone has 2 copies of gene, which each of gene come from parents. Normally, 2 copies of gene are being activated, but unfortunately for gene imprinting, some genes are preferred to be silenced, which is not activated based on which parent that gene comes from. The under control of an imprinting process have been associated with several disorders including Russell-Silver syndrome. Before this, we diagnosed this patient using molecular testing. The first one is genetic testing, but this method only effective for patients with known causes of Russell-Silver syndrome involving chromosome 7 and 11. Currently, new method was developed, which is Next-Gen Harbison Clinical Scoring System (NHCSS), using prospective data. It is flexible to use, even the data are incomplete. The diagnosis have to made in infancy before information about postnatal growth and BMI are available. This figure shows the NHCSS diagnosis criteria for Russell-Silver syndrome patient. Next, I will pass this presentation to Nurin.
Thank you, Adila, for your explanation. Now, I'm going to talk about the symptom of Russell-Silver syndrome in children. There are many symptoms of Russell-Silver syndrome. Most of them are present at birth, but some of them actually appear in the early childhood. Most of the people with Russell-Silver syndrome may have normal intelligence, but they may experience delays in reaching early developmental milestones. There are major and minor symptoms in Russell-Silver syndrome. The major symptoms include the first one is a small stature at birth, which is below the 10th percentile. The second one is after the birth, the baby grows below the average of normal head and length, which is below the 3rd percentile. But for the head circumference, it is normal, which is between the 3rd and 97th percentile. For the minor symptom, the patient may experience short arm stump, but normal upper to lower arm segment of ratio, triangular shaped face, and prominent forehead.
Okay, thank you Nurin for your explanation. Now, I want to talk about nutritional plan for Russell-Silver syndrome. Treatment toward Russell-Silver syndrome is directed toward the specific symptoms that are apparent in each individual. Early diagnosis and intervention can help to improve growth and ensure that affected children can reach their highest potential. Okay, firstly, gastroesophageal reflux. Children with RSS usually have feeding difficulties. Feeding difficulties can cause gastroesophageal reflux. So, decreasing the food that are high in fat and providing a smaller but more frequent meals can help to improve delayed gastric emptying. With this, it can avoid gastroesophageal reflux in children with RSS. Okay, next is hypoglycemia. To avoid low blood sugar levels, children with Russell-Silver syndrome should never go without food for a long period of time, and they should go to emergency room for glucose infusion when they are ill and unable to eat food by their mouth. Lastly, for growth, it is important not to overfeed an RSS infant. Babies born with small for gestational age should remain lean but not underweight due to high risk of medical problems related to insulin resistance and metabolic syndrome. Increasing the calories of a child with Russell-Silver syndrome can result in a brief spurt of growth, which often then levels off. The child simply becomes more overweight rather than gaining any further height. So that's all from me. Thank you.
Thank you, Hana, for your explanation. My name is Amirah Shakirah Binti Ahmad Rizal from ISM Dietetics Semester 3. Now, I want to talk about the plan management for the children with Russell-Silver syndrome. There are some plans that can be done with these children so that they can live as happily as the other normal children. This plan management should be done in their early age of life as the Russell-Silver syndrome are present at birth. Some plan management that can be done for the Russell-Silver syndrome children are they can be injected with growth hormone and also get luteinizing hormone releasing treatment for the growth and development of the children. Beside that, for the correction and accommodation of the limb asymmetry of the children's bodies, shoe lift and corrective surgery are very important to gain symmetry position of the children's limbs. Furthermore, there are also treatments that can manage the mental and social development of the children, such as speech therapy, language therapy, physical therapy, and they can also join the early development intervention program. These treatments can help them to speak normally as the other normal children that are in the same age as them. This plan management for the children with Russell-Silver syndrome are very important so that they will not feel separated with the other children and they can live a normal life as the other children. Based on all the explanation of Russell-Silver syndrome in children, we hope that all parents out there are alert with their children's health so that they can live as normal as we are. That's all from us. Thank you.